Hello, I'm Lisa Obradovic and would like to welcome you to the podcast Certification Inspiration, produced by the Wound Ostomy and Continence Nursing Certification Board, otherwise known as WOCNCB. Founded in 1978, WOCNCB is a not-for-profit professional international nursing organization certifying over 9,000 registered nurses who are specialists in the field of wound, ostomy, continence, and foot care. In this episode, you will hear from Jeanine Gleba, the Advocacy Manager at United Ostomy Associations of America, and Joanna Burgess-Stocks, a Certified Wound Ostomy and Continence Care Nurse, or CWOCN. They will be discussing the value specialty nursing certification brings to patients, their families, and the facilities where they serve.
Hello, my name is Jeanine Gleba. I'm the Advocacy Manager at United Ostomy Associations of America, commonly known as UOAA, which is located in Kennebunk, Maine. I work remotely from my home state of New Jersey. UOA's mission is to promote quality of life for people with ostomies and continent diversions through information, support, advocacy, and collaboration. I've been with the organization for 4 years now, and I've over 16 years of experience of advocacy work, including partnering with groups to achieve a common goal and raising awareness for a cause. I'm very passionate about inspiring others to self-advocate and make positive changes, especially for underserved populations, whether it's my own town small library or the ostomy community. We can all make an impact. Today I am with Joanna Burgess-Stocks, a certified wound ostomy and continence nurse. Some of Joanna's contributions to WOC nursing include serving 3 years on the WOCN Society's National Ostomy Committee, where she helped in developing the pediatric ostomy complications best practice for clinicians. We are here to talk about the need and benefit of obtaining a certification in the field of ostomy care. Our goal today is to inspire more nurses to join the specialty profession. And for our listeners, you may hear us use the acronym WOC Nurse in this podcast, meaning a nurse with specialized education and skills in the areas of wound, ostomy, and continence care. Joanna, please tell us a little bit about yourself.
Well, thank you, Jeanine. I'm so glad to be here with you today talking about this very important topic. I have been a certified ostomy care nurse now for, my goodness, almost 14 years. I had a passion for this field of nursing because I myself have an ostomy, specifically a urostomy, since the age of 3 for bladder cancer. Back in the day, which would have been back in 1965 when I was treated, ostomy nursing was only in its infancy as a profession, and there was no ostomy nurse, let alone a certified ostomy care nurse at Boston Children's Hospital where I was treated. As you can imagine, it was a traumatic experience for my parents, basically having to learn through trial and error how to care for me on their own. We had no one to turn to. My ostomy beginnings and the need to help patients find their voice for self-advocacy is what inspired me to run for and eventually become elected to the Management Board of Directors of UOAA and eventually to you, Jeanine, as I was appointed chair of the Advocacy Committee for UOAA. I currently work at WakeMed Health and Hospitals in Cary, North Carolina, where I work both in acute care and run their outpatient ostomy clinic.
UOAA has been receiving stories of inadequate ostomy care in every type of healthcare facility, whether it's acute care, assisted living, home health, or rehab, for years. The services of a certified ostomy nurse in these facilities is limited, and in many situations, the ostomate has poor outcomes. We've also seen more nurses focusing on a certification in wound care alone versus a certification in wound and ostomy care, and even less in the tri-specialty area of wound, ostomy, and continence care. Did you know that in 2019, there were around 2.86 million registered nurses in the United States, and according to the Wound Ostomy Continence Nurses Certification Board, there were 6,000 certified ostomy care nurses. There are between 725,000 to 1 million people living with an ostomy or continent diversion, and approximately 100,000 ostomy surgeries are performed each year in the United States. So across the country, there's a large gap in access to certified ostomy care nurses. Lifelong continuum of care is critical, and quality of care should not stop after the patient leaves the hospital. Evidence and studies have shown that patients in home health agencies with certified wound ostomy continence nurses compared to those without certified nurses had significantly better outcomes. Now we just need more of these special nurses to fill the demand. Joanna, can you explain why someone interested in going through the training to provide ostomy care should consider becoming certified?
Wow, Jeanine, I just have to say first, that is a staggering number and such an eye-opener to the discrepancy between the number of nurses in the United States and the number of certified ostomy care nurses. But to answer your question, nurses can go through coursework to learn how to provide the physical and emotional aspects of ostomy care without getting a certification. However, what I recommend, by going the next step to certification, it demonstrates that a nurse has acquired additional knowledge, skills, expertise, and honestly even attitude to provide high-quality care to patients and their families. This also shows a current or future employer that this nurse is a lifetime learner who cares about quality and excellence in healthcare delivery. I also feel that a certified ostomy care nurse feels more confident in that they are providing the most up-to-date, evidence-based care. Certified nurses are very proud of their achievements, and I know I am, and are likely to be role models for other nurses and healthcare professionals. They are also more likely to become involved in their professional organization and other organizations that assist ostomy patients.
What do you think are some of the obstacles or challenges with getting more facilities to hire this profession to ensure these negative outcomes are avoided?
Jeanine, I think it's simply about helping a facility understand why this role is so important. An example of this is when I started at my acute care facility, which is a small hospital with 125 beds. I was only hired for 6 to 10 hours a week. But once doctors, administration, and nurses began to see the impact of the role I had on both caring for patients and in educating staff, it quickly turned into a full-time position. To help nurses articulate the importance of this role to employers, there are position statements on the CWOCN website discussing key points to help a facility understand the importance and significance of this role.
Oh, that's great. How does someone know they are ready to become certified?
Jeanine, it's all about preparation. Preparation for certification requires that nurse meet the eligibility requirements, such as gaining experience in providing direct care for a required period of time for this particular patient population. It also involves setting certification as a specific target goal, studying, and acquiring the knowledge needed to pass the certification exam. There are courses and various study materials that can help a nurse to prepare for certification. The CWOCN has even created official flashcard sets that are either printed or can be found on a mobile app. Also, there are self-assessment practice exams that can help nurses know if they are ready to sit for the exam to become certified. It's really, Jeanine, about finding the right study materials for you. And I can't stress enough why I feel certification in ostomy care is so important. Did you know that a certified ostomy care nurse can add value to the staff in a healthcare facility by assisting the surgeon in siting a manageable place for a stoma, by teaching staff nurses how to care for ostomy patients, by providing best in-practice standards of ostomy care as recommended in UOAA's Ostomy and Continence Diversion Patient Bill of Rights, by collaborating with industry and providing the best products for ostomy patients, by having the skills and knowledge for properly assessing and treating peristomal skin issues that can result in avoiding hospital readmissions. by ensuring patients have a properly fitted ostomy pouching system to avoid leakages, which improves patient outcomes. We also add great value by being influencers. I know in my own facility, I was able to start an outpatient ostomy clinic because my surgeons began to recognize the importance of my role, and this influenced administration to help me to develop the clinic. CWOCN nurses are considered experts in the field and provide a wealth of knowledge and are a valuable resource to other clinical staff.
Wow, and that's not an all-inclusive list. You know, UOAA sees firsthand the positive difference having access to a certified ostomy care nurse makes in the lives of our ostomy community. Ostomates are better able to learn to adapt their ostomy both physically and emotionally and have improved quality of life. This is in contrast to people who don't have access. We receive heartbreaking calls from people who have either never had an ostomy nurse after surgery or cannot access one after they leave the hospital, especially in rural areas of the country.
Jeanine, did you know that facilities who don't have a certified ostomy care nurse have a higher rate of poorly placed stomas because there is no nurse to assist the surgeon with sighting the stoma mark? They have higher incidence of pouch leakage and peristomal skin problems. They have poor overall patient satisfaction with their hospital experience in general, and they have potential increase in readmissions due to pouch and skin issues. And unfortunately, patients experience decreased quality of life.
UOAA has witnessed this. We had a sister call for her brother who 13 years ago had a bike accident that left him with brain and spinal cord injuries. He just recently needed an ostomy. The home health nurse came out one time and said, I should be all set taking care of his ostomy, but she had no idea what she was doing and was very nervous trying to change the pouch. A few weeks ago, I personally spoke with a family member regarding the quality of care received. This person told me, in both rehabilitation centers that my mother-in-law was placed in, none of the staff were properly trained to care for someone with an ostomy. While in her first rehab center, her pouch leaked and she was left in her mess for hours with a promise that someone would be in to change her ostomy pouch. While under this facility's care, the patient became so sick with an E. coli infection that she had to be readmitted into the hospital. According to the family member, every time she was in the hospital, she got better and received the proper ostomy care from the certified wound ostomy continence nurses, but there was never a continuation in quality of ostomy care after she was discharged from acute care. It's really disturbing to think that these scenarios are happening every day out there.
And I believe these scenarios can be avoided. Did you know that patients who have a certified ostomy care nurse more easily adapt to an ostomy? They have more success with self-care, and that leads to independence. They are more confident in the ability to self-advocate as well as their families, and they are better able to return to functions in their community and to work, and they are more likely to be positive mentors to others who face ostomy surgery.
This is so true. UOAA has a certified ostomy visitor program at many of our affiliated support groups. These group leaders see the impact a certified ostomy care nurse can make. One story that comes to my mind that was told to me by a leader of a local group is Abe's story. There is absolutely no question of the help the certified wound ostomy and continence nurses provided in giving him back his life. This leader received a call from his significant other that he was unable to leave his house or even his bed after his ileostomy surgery. Visiting home health nurses not certified in ostomy care were unable to find a way to deal with his stoma, which was flat on his abdomen. Anything they applied popped off minutes after they left, and the steady flow of unsuccessful efforts was weakening Abe's resolve to return to good health. He was leaking each and every night and would only lay flat on his back for days at a time. Immediately, this support group leader advocated for them to be seen at her nearby ostomy outpatient clinic and told the significant other that with the right guidance and knowledge, Abe's stoma could be built up and fit into some of the more unique appliances available. After several appointments, the certified wound ostomy and continence nurses were able to get him a proper fitting pouching system for his needs, and Abe has returned to work and life, movies and dinners, seeing his grandchildren, and smiling again. We want this experience for everyone that is on an ostomy journey. UOAA also gets calls from ostomates and caregivers saying the staff has no idea how to care for the ostomy and asks us why don't nursing homes have a certified wound ostomy and continence nurse. Joanna, in your opinion, why do you think nurses don't pursue the certification? Is it an awareness issue, cost prohibitive, preference for being simply a general nurse versus a niche specialty? It really takes a special person to join this profession. Let's face it, you are dealing with human waste, which is not the most glamorous job.
Jeanine, I really believe it's simply about raising awareness about this type of nursing. Any nurse who has known and observed a certified WOC nurse is quite amazed at her skills as an expert clinician. We are very science-driven, and we are very creative nurses. This inspires nurses to go into this profession. I know that I wanted to be just like the first WOC nurses that I ever knew. I thought they were amazing. However, not all nurses have the experience of watching a WOC nurse. Did you know that we can increase visibility for this profession by asking to speak at nursing schools about this profession, by writing for nursing journals about the experience of a certified ostomy care nurse? And certified ostomy care nurses also need to educate and mentor nurses to become certified. Nurses should be encouraged to spend the day with a certified wound and ostomy nurse.
UOAA wants to also help. Joanna, what do you suggest the ostomy community do to help encourage more nurses to become certified ostomy care nurses?
Jeanine, patients have a powerful voice in creating change, and I have a great example of that. I had a patient who had to travel 2 hours just to come see me at the outpatient ostomy clinic. She was a very nice woman, but she was so angry that she had to travel so far. She asked me why her facility didn't have an outpatient ostomy clinic. We ended up having a great discussion about how she could turn her anger and passion into working with her own certified WOC nurse at her facility to start their own outpatient ostomy clinic. They ended up going together to the administrator of the facility, and after about a year, they had their own outpatient ostomy clinic, a true story. At UOAA, we often say, and our motto is, together we are loud and strong. We need to encourage ostomy patients to talk about their experiences with administrators to make needed changes. The fact is, we are in an era of patient satisfaction ratings, and that makes a difference.
I love hearing success stories like this, and I totally agree that we're in the era of patient satisfaction ratings, and that makes a difference. This is why we create so many self-advocacy toolkits and encourage people to speak up. If nothing's ever said, nothing's ever going to get changed or done. And that's why our motto is advocates for a positive change.
Jeanine, I have to say that my life as a certified wound ostomy and continence nurse is one of the most fulfilling and rewarding things that I do in my life. I am able to help patients who have faced a life-altering illness that affects them on every level, physically, emotionally, and spiritually. They often feel lost, overwhelmed, depressed, and often cannot imagine how they can even live with what has happened to them. I am able to help them grieve, to cope, adapt, and finally thrive as they learn and finally believe that their ostomy saved their life. To me, that is profound, and my patients end up being such a gift to me as I believe I am to them.
Joanna, you have no idea what a gift you are to me being our advocacy chair. You've made such a tremendous difference in the work that we've accomplished. UOAA's Advocacy Committee has a vision for 2020. By the end of the year, we want to see more nurses getting a certification in the specialty of ostomy care, especially those working in other facilities, such as rehabilitation centers and home health agencies, to improve post-surgery care and quality of life. We're going to start an awareness campaign this year and hope current certified nurses will spread the word too. Joanna, thank you so much for all that you do for the ostomy community and for helping us to inspire more nurses to get a certification in ostomy care.
Thank you for listening. WOCNCB sets the standard for wound, ostomy, continence, and foot care nursing certification by validating nurses' knowledge to provide safe, patient-centered care. Until next time, visit WOCNCB.org to learn more or contact WOCNCB at info@WOCNCB.org. And remember to follow us on social media. This podcast is produced by WOCNCB. Take care.